Hi, I'm Audra Burns from Dartmouth Health, and welcome to Heads Up, a year-long mental health awareness journey. This is our webinar series, which focuses on important mental health topics that affect all of us. Today, we will be discussing the unique mental health challenges of our older adult population. I'm joined by three incredible panelists for this conversation. So let's welcome Phyllis Whitney. She is a patient family advisor for Dartmouth Health. Hi, Phyllis.
Hi, nice to be here this morning. Thank you.
Thank you for joining us. We also have Dr. Courtney Stevens. She is a licensed clinical psychologist at Dartmouth Health and assistant professor of psychiatry at the Geisel School of Medicine at Dartmouth. Welcome, Dr. Stevens.
Good morning.
And joining us is Dr. Ed Mahoney. He is a licensed psychotherapist at Bedford Counseling and an educator at the Mental Health Center of Greater Manchester. And he is also the co-founder of a program that is for 65 and older adults, which is called Storytelling, Remembering Together. Welcome, Dr. Mahoney.
Thank you, Audra. Thank you. Welcome.
It's great having all three of you for this very important conversation. Now, mental health is often, unseen and an unspoken problem among older adults. And as people age, there's, isolation, loss, the strain of caring for aging or ailing partners, among other issues, and that can compound the mental health challenges they face. So, Dr. Stevens, I want to start with you. What would you say are the foremost mental illnesses of which older adults are at risk, and what are some of the factors that are contributing to that?
Yeah, absolutely. Okay, so we know that according to the CDC, about 1 in 5 adults over age 55 has some kind of mental health concern. And depression is the most prevalent mental health concern that we see in this older adult population. And while it is quite common and symptoms of depression are quite common associated with increasing age, it's important to note that depression is not a normal part of aging. Other mental health concerns that are commonly experienced in this age group are anxiety, cognitive impairment, chronic pain, insomnia. And in a lot of ways, having one of these issues increases risk for another issue. That's what we call being comorbid. And so there is kind of a double whammy sometimes of having both dealing with an issue like a sleep problem and also an issue like a depressed mood. So that can really compound on each other. Factors that contribute to these issues and depression in particular. So I use a behavioral lens to understand depression. And specifically what I mean by this is that this perspective understands depression as being the result of a disconnect between what's important to someone and what they do on a daily basis. So as we age, life context shifts, and as a function of changing life circumstances, our environment, differences in social support networks, proximity to family, maybe changes in your mobility over time, all of these alter your opportunities to engage in activities that provide that sense of positive reinforcement through pleasure or feeling masterful or effective. And when there's fewer opportunities to do those activities due to these changing circumstances, that can lead to depression. Another thing is that given these changing circumstances, people often need to adapt or modify the way they did activities before. And that's a really hard thing for a lot of people to accept, that they can't do things as they once did. And so often what happens is they just stop doing them. And that can increase your likelihood for depression.
And that's such a powerful statistic that you shared. The 1 in 5 over 55 might have mental health challenges, because I think often, we talk about being concerned about, our own mental health and being aware of signs that we might be struggling. But, the 55 and plus, that's our parents, that's our grandparents. And so making sure that we're aware that they might be struggling is very important. So thank you for sharing that. And now I wonder, how are some of these issues affected by the upcoming holiday season?
Right. Well, when you think about the holiday season, I think many people think about traditions and things that these are activities, right? That's what traditions are. They're things that you do consistently over time. And as people's life context shifts, maybe their children aren't close to them anymore, they're more isolated, maybe they can't, get up and decorate the house in the same way that they used to, or there are other reasons why it's more difficult to do the things that the holiday season involves. That can be quite demoralizing. Also, just if, I think the holidays tend to evoke these, in a good way, sense of family and connection. But if you have lost a loved one, even if it's not, necessarily that recent, that absence of that important family member or close friend being connected in that holiday time can evoke a lot of sadness and be something that sometimes is like when that occurs, sometimes that's a temporary sort of state, that the holidays sort of evoke this feeling of disconnection from a lost loved one, and then maybe it kind of gets back to normal after the holiday season. But what my point that I was making before, just in terms of how ability to engage in certain holiday routines changes over time, that I think has a lot to do with why you might see some increased depression around the holiday time.
Yeah, absolutely. And you touched upon, loss and grief, and this is a great time to bring in Dr. Mahoney, because your expertise is in grief and loss. So what do you think, most people fail to understand about the experience of older adults who are dealing with loss?
Mhm. Well, obviously, grief involves all the things that we experience when we are dealing with one of life's losses, especially the death of a loved one. And coping with the losses that we experience is difficult at any age, but I think it's particularly challenging for those who are in later life. And I think probably one of the things that's hard to appreciate is how these losses affect a person during that time of their life. For example, one of the things that happens as people age is losses tend to accumulate over time, and we experience many losses as we age. And I think, in addition to the fact that it's one of the examples would be many experience a sort of shrinking circle of support system, loved ones and friends as they are no longer in that person's life, and tends to lead to a sense of isolation. But probably one of the more difficult things to appreciate is the fact that as we age, we experience loss on many levels and frequently at the same time. So a person may be experiencing problems physically, as they may be experiencing illness of different kinds, or becoming more frail. At the same time, they maybe have experienced maybe the death of a spouse or other significant losses. So losses get compounded that way. And I think that that's probably one of the more difficult things to appreciate, and for us to relate to, is what the full impact of that is when we're sort of getting hit on all sides, so to speak, by different losses in our lives. And that obviously can lead to some of the things that Courtney mentioned, a sense of anxiety and depression. And so I guess I would say that that's probably one of the more difficult things to appreciate.
Well, thank you for bringing that to light, because I think, like you said, with the social circles, shrinking and isolation because of loss, or maybe a physical impairment that they can't get out as much. That's just such a good reminder that we need to be, checking on our older adult connections that we have to help grow their circle, because they might be, like you said, experiencing multiple losses. So now, Phyllis, why do you find many of these problems are often unnoticed and unaddressed?
Well, I think this is another example of a loss, a sort of a loss of complete mental health, or what's perceived as complete mental health. And I think there's still a stigma attached to that, especially maybe among older people. They may have a sense that something is wrong, but they're not really sure what. They don't want to bother people. You know, we're older, we've spent our lives taking care of other people. And now to admit that we may have, you know, need somebody else's help doesn't feel so comfortable sometimes. People feel, I think, that well, I can manage on my own. I've, you know, handled other things. I can handle this as well. And also perhaps not knowing what resources are out there and how to access them. I think all of that contributes.
And this is a great segue to you, Dr. Stevens. So what are some of the best ways to prevent or alleviate depression and anxiety as an older adult? And, you know, what should older folks be asking themselves, or how can they start, you know, the work on getting healthier?
Right. So because depressed mood has so much to do with what you do throughout the day and how you kind of schedule your time, that's really the first place to start taking a look, is seeing how are you spending your time throughout the day? Are you engaged in activities that are pleasant, that are enjoyable, or that are important for some other, you know, maintaining, you know, maybe you have to go to your doctor's appointment or make sure you get bills paid, tasks that are important to get done that you can feel masterful about once they're completed. Do you have opportunities to get that sort of good feeling throughout the day from the things that you're doing? And if not, attempt to schedule more of those pleasant activities. And better yet, if you can schedule pleasant activities that involve other people, that is likely to help a lot, because having the accountability of making plans with someone else increases the likelihood that you follow through on it. So, you know, it is maybe the case that some pleasant activities, like, you know, watching TV, have diminishing effects in terms of how good they feel over time. So I think sometimes you might start out doing an activity like that, thinking like, this is pleasant, this is a good mood boosting activity, this is comforting. But if it goes on for hours and hours and hours without disruption or without engaging in other activities, oftentimes there's lack or loss of the kind of potency of the good feeling from that activity over time. So examine that sort of thing too. Are you kind of getting trapped in certain activities that feel good at first, but maybe don't continue to benefit or don't allow you to then extend out and do other things that also need to get done? That is the big one in terms of mood, is looking at what you're doing and attempting to reduce things that are not bringing those sorts of elements of positive reinforcement in terms of good mood or pleasantness or mastery or fulfillment, because you're acting in some way that's connected to what's most important to you.
And that you also kind of touched upon something that Dr. Mahoney had shared about, you know, you're saying, you know, it's important to try and schedule things and maybe possibly do them with other people, which would then help with that expanding those social circles as well, which Dr. Mahoney touched upon. So that's great.
And oftentimes we feel a hesitancy, you know, when you're struggling with some depression or anxiety, there can be a urge to cancel plans or to not reach out, even though you're sort of thinking that you might like to. And that's something to pay attention to. That's a normal kind of response that people have when they're trying to break these cycles. And if you can allow yourself to feel that apprehension and still go ahead and, you know, go out for that lunch date or still pick up the phone and make that call, even though you're feeling a little bit unsure about it, most of the time you don't regret taking that action afterward. It's just the apprehension that happens on the front end that can lead to people avoiding doing it.
And that's an important reminder too, for on the other end, you know, the caregiver or the family member, if someone is constantly canceling on you, then maybe that's the flag that you need to, you know, check in with them. Like, hey, are you okay? You keep canceling our plans and not showing up. So that's a great little tidbit. Thank you for that.
Absolutely.
Now, Dr. Mahoney, let's, you know, tell us a little bit about this storytelling program and how that experience is helping older adults who are participating.
Well, thank you for asking about that. The Mental Health Center in Greater Manchester, where I work, along with many other agencies and programs, are well aware and have been well aware of some of the problems we've already talked about of the aging population experience and what the mental health difficulties are that are associated with that. And so about 2 years ago, we really stepped back as an agency and tried to look at approaches that we were taking to help people struggling with mental health issues in the aging population. And in that process, we really became intrigued with studies that were showing the benefit of storytelling in helping prevent some of the difficulties we've talked about of anxiety and depression, as well as ways of helping people who are experiencing those problems. And so that led to us looking at these studies and developing our own program called Storytelling, Remembering Together. It's based on the fact that storytelling, listening to stories and telling stories is part of our life from the time we're very young. And so it's a natural way for us to communicate with each other. And so what we noticed was that this would be a way to minimize some of the barriers that, for example, Phyllis talked about of people reluctant to seek help. And many persons in aging come from that place where it's hard to ask for help. And then there's the stigma that's sometimes associated with mental health care. And so inviting people to participate in storytelling with other people their same age knocks down a lot of those stigma barriers that you might otherwise encounter. And that's been a wonderful experience. We found that there's been many other benefits of storytelling or inviting people to meet together to share stories, to reminisce about things that they've experienced in their life with each other. It forms a powerful sense of connection that people have with each other as they listen and tell their own stories. It can certainly give people a help with a sense of purpose in the process. Studies also show that there's a lot of neurological benefit in helping people with recall and memory and cognition. And so one of the things that's sometimes hard in traditional treatment to engage elders with is their ability to share some of the emotions they experience that oftentimes can become problematic and obviously sometimes lead to depression. Telling stories, emotions are deeply embedded in the stories that we share and tell each other. And so it's a natural way, a pathway, if you want, for people who participate in the program to experience in a very healthy way a lot of emotions that are attached to the stories that they tell. It also sometimes is a sense of humor that encounters as people tell their stories, which I think we don't often appreciate. The ability to kind of laugh at ourselves or laugh around stories that we share with each other, or whether it's in a family. But so this program, Storytelling, started about a year and a half ago, and it was the Mental Health Center partnered with the Manchester City Library to offer this program. And it consists of people meeting twice a month. And in that time, it's a very simple approach, but very powerful and effective approach, is at each meeting, there's a question that people are asked to share stories about. It may be, one of the questions may be, what was your favorite holiday? Courtney mentioned that holidays are a powerful time of year and tap into sometimes the losses that we've experienced. And it's a kind of natural thing that happens. But so one of the questions, as I said, might be, what was your favorite holiday? And as people begin to share their experiences, they kind of tap into each other's experiences, and it becomes a very rich sharing experience. Who was the most influential person in your life is another question that might be asked, and then people are invited to share about that. And people react to and relate to and identify with each other's stories. It's just a wonderful, wonderful process. So as I said, we've been doing this for about 1.5 years now, and we will continue. We have another series coming up starting this month. And so I'm glad to share this. I think it's been an eye-opener for me as a clinician for many years to a way of approaching care for elders that may be somewhat non-traditional, or the way I might approach clinical work. But I have just seen and witnessed myself the powerful benefits of this, and hopefully this will help to expand that by helping people understand and maybe participate in similar programs or our program.
It sounds like a fantastic program. And I love that you have specific prompting questions, because I think often, we might ask, our parents or grandparents, tell me about your life. And that's such a big question, but where you're really drilling down on individual experiences with memories that they can very specifically speak to. That's so unique. And so for our viewers, I will make sure that we post the link to that information at the bottom of this video. So please do check that out. So now, Phyllis, how can family members of older adults help if they are seeing signs of depression and anxiety?
I think some things are important to do, whether you see signs of depression or anxiety or not. I think the most important thing is reaching out and staying in touch. And it doesn't have to be anything lengthy. It could be a quick call at the end of the day saying, how did your day go? Or a call in the morning saying, what's on your agenda for today? But reaching out and staying in touch is really definitely important, I think. And I'm a little bit leery of technology, because I think older adults may prefer speaking on the phone, whereas younger people prefer texting. And so you really need to figure out a good compromise that works for both members or for all the members involved. And I think younger people, family members and friends can reach out and try to get older people involved in activities, either family activities or community activities. I know in my own case, a couple of neat things happened. My daughter has a friend whose mother moved to the Upper Valley shortly after I did. And so the two younger women got the two of us in touch, and we now get together once a month to have lunch or breakfast or chat or whatever. My son has sent me listings of activities in the Upper Valley that he thinks that I might be interested in and enjoy doing. So it's those kinds of, they're not huge things, they're little things, but they add up and they're really important.
Those are all really great tips. Thank you for sharing that. So we're just about at time right now. So very briefly, before we wrap up, I'd love to get from each of you, one key takeaway that you want our viewers to have from this webinar. So Dr. Stevens, I'll start with you.
Great. So I think to just keep on this point that I've been saying about how activity is so important for buoying mood, there's this saying called act from the outside in rather than the inside out, meaning that you plan what you want to do in a given day. You are scheduling things that are pleasant, getting things done that need to get done, are important, etc. You are scheduling those things and doing them even if you don't feel like it when the time comes to do them. Even if you feel tired, even if you think maybe I'll do this when I feel better or have more energy, do it, plan it, and do it. And that is acting from the outside in rather than the inside out. And inside out means that you're allowing your emotion to dictate what you do rather than what is important to you dictating what you do. So that's where scheduling it and doing it, even if you have that apprehension feeling at the outset, notice how often you feel differently after you get started with the activity. So that's the main thing, I think, for our older adults, if I have one key takeaway. But to piggyback on this conversation about what can family members do, this notion of how when people get depressed they start to withdraw is really something to be sensitive to, because I think that if you don't understand that that's part of depression, you can think that this person doesn't want to engage with me, or they're being standoffish, or I don't understand why they aren't letting me know when something happens. Those are all features of what happens to a person when they're feeling depressed. They withdraw, they don't reach out, they are concerned they're going to be a burden if they ask for help. So if you start to notice that a loved one that you have is canceling or not communicating well, doing things that you might consider to be avoidant, that's a key that you might want to be assuming that they're struggling rather than they're just being difficult. I think that is a hard pill for a lot of people to swallow, but it's very, very true. So in terms of resources in the community, I really encourage older adults to engage, connect with your family and friends to the extent that you can, and they're local, and learn new ways of connecting via technology if they're not local. But there are other things like community resources. Here at Dartmouth, we have the Aging Resource Center at Dartmouth, which is located up in the Centera Plaza, which is wonderful and offers many different classes for older adults. There also are area agencies on aging, which is a nationwide program. And of course, different local nursing homes and other centers like that. So those are all helpful for just staying connected and having the momentum to keep kind of having a schedule and having things to do on a given day. So you have a sense of that purpose and forward direction. So that's what I would say. Thank you.
That's excellent advice. Thank you. And we'll be sure to link to those resources that you mentioned. We'll have that at the bottom of the video for our viewers to check out. Dr. Mahoney, what's your key takeaway?
Well, I guess I would say I mentioned is the kind of the discovery of the power of storytelling in helping people cope with a lot of the kind of challenges that we've all talked about today, and especially mental health challenges that people might face as a result of isolation and whatever. So I think it's the power of stories and storytelling and how effective that can be. And what you mentioned is what was helpful for us is designing the program to be quite simple, and that is having a direct question and realizing the effectiveness of that you had mentioned, and how that leads into people being able to express the kind of emotions that and experiences and life experiences that they might find it difficult to do otherwise. And so I think the structure and what Courtney mentioned, that bi-monthly meetings provide some of that structure that she talked about, that's really helpful. I think having a structure just opens the door to some of the powerful experiences that people have with each other. So I think that's probably the biggest takeaway.
Well, I hope you have a very robust group at your next
Thank you.
storytelling program. Phyllis, what's your key takeaway?
I think for me, the most important thing is reaching out for older adults to reach out to their relatives, to their friends, to the community, and for younger adults, family members, friends, to reach out to the older population, to check in with them to make sure everything is okay, and to include them in activities to help them figure out things that they might want to do to keep busy and to be involved.
I think that's an excellent takeaway, and something that all of our viewers hopefully could do, maybe after watching this video, once you're done viewing this program, if everyone picks up the phone and checks on a loved one just to say hello, that would really go a long way. So Dr. Stevens, Dr. Mahoney, Phyllis, thank you so much for joining me today and having this very important conversation.
Thank you.
Thank you very much, Audrey. Thank you.
So to view past heads up segments, you can access them to the link on our screen that you're seeing on the video. Thank you so much, everyone. Take care.
You too.
Bye-bye.
Thank you.